Hey everybody, it's Paul Yokobitis from Cary Estate Planning, back with another video as part of our 2020 challenge. And today I wanted to talk about some sombering news and developments in the COVID-19 issues that we're having in the United States, and some very practical considerations for the use of healthcare documents in a hospital setting with COVID-19. So we're seeing recent reports in hotspot cities like New York and Chicago, where hospitals are beginning to evaluate whether it would be appropriate to give DNRs to all COVID patients, basically saying that they're not going to resuscitate if a COVID patient codes. And that's mostly because of two factors. One, that they just don't have the medical resources right now for PPE and ventilators. And so they're having to essentially pick who gets those ventilators and resources. But it's also very risky for a medical care provider to administer CPR and life support to someone with COVID. So in an effort to mitigate those issues, that's a decision that some hospitals are potentially going to make soon. So it brings about a couple very practical tips and things that you should probably implement immediately. Is if you do have healthcare documents, your family is not going to be able to see you if you're a COVID patient in a hospital. You're going to be isolated, so that your healthcare power of attorney is not going to be with you if they have to make decisions for you. So you need to have those documents saved in your phone in a digital format. If you're one of our clients, you would have gotten those as part of a PDF scanned executed version via email. You need to have that saved on your phone. You need to make sure that if you are admitted as a COVID patient, that you show the hospital those documents immediately so that they understand you do have healthcare documents in place. And it's also important to make sure that the contacts or the people named, your healthcare agents, are contacts in your phone under your emergency settings, especially if it's your spouse. So that way, the doctors don't have to try to figure out what your passcode is. They can just use the emergency functionality on an iPhone or an Android device to be able to reach these people as soon as they need to. You want to make things as easy as possible. So in this new COVID-19 reality, these healthcare documents are still very important, but it's just the logistics of using them are very different, just because of the isolation and the practical realities of that. So if you do not have healthcare documents, let us know. We'll be happy to help you out for free. If you do, make sure they're scanned and saved to your phone, and make sure that these people named on those documents are saved in your phone as contacts as well. If you haven't done that already, you should do that immediately. This is Paul Yokobitis from Cary Estate Planning.